Hi everyone, welcome back to Health Improvement Visionaries. Welcome to the HIVLLC channel. If you're a health or program leader working to improve health outcomes and tackle health disparities, this channel is for you. Our mission is to empower leaders like you by providing interdisciplinary insights and actionable strategies that benefit vulnerable and minority populations. I'm Suzanne, and today we're tackling an issue that hits home for many of us: how health program managers can design impactful workshops to promote healthy sleep and eating habits in minority communities. These two pillars of health are deeply intertwined, and addressing them effectively can lead to transformative change. Let's dive in. Let's talk about cultural relevance. This is the foundation of any successful health program, especially for sleep and nutrition. Every community has its own unique traditions, beliefs, and practices. Food is about more than sustenance. It's family history and cultural celebrations. We need to honor these traditions when discussing healthy eating. Many cultures have inherently healthy eating patterns. Think about lentils in South Asian diets or nutrient-rich greens in African American cuisine. Our goal is to build upon these traditions, not replace them. Emphasize balance and portion control within their existing preferences. The same goes for sleep. Evening family gatherings might impact sleep schedules. Adapt routines to optimize sleep without abandoning cultural norms. Meet people where they are and find solutions that fit their lives. Now, let's talk about another critical aspect: access. We can't talk about healthy eating without acknowledging the very real challenges of food deserts. Areas where access to fresh, affordable produce is limited. This is a systemic issue that disproportionately affects minority communities. So, how do we address this in our workshops? We get practical. Let's introduce participants to affordable, healthy options that are readily available. For example, frozen fruits and vegetables are a fantastic alternative. They're often more affordable than fresh produce and just as nutritious, since they're picked at peak ripeness and flash frozen to preserve nutrients. We can also use workshops to teach participants how to make the most of pantry staples like beans, lentils, and rice, which are budget-friendly and incredibly versatile. It's about empowering them with the knowledge and skills to make healthy choices within their means. The same goes for sleep. We can't ignore the realities of shift work, crowded living conditions, and other factors that can impact sleep quantity and quality. Instead of simply preaching about getting 8 hours, let's offer practical strategies. Could they benefit from incorporating short power naps into their day? Would a sleep mask and earplugs help create a more conducive sleep environment even in a noisy or bright setting? Remember, it's about acknowledging the challenges and working collaboratively to find realistic solutions. Chapter 3: Community Engagement. The power of collaboration. Now let's talk about a key ingredient for success: community engagement. We can design the most culturally relevant, accessible workshops, but if the community doesn't feel ownership, they won't reach their full potential. The most impactful programs are those built in collaboration with the communities they serve. We need to move away from a top-down approach and embrace the wisdom and insights of the community itself. Start by partnering with trusted messengers. These could be local leaders, faith-based organizations, community health workers, or even social media influencers who already have the ear of the community. Their involvement brings credibility and fosters a sense of trust. Think about co-creating workshops with community members. Invite a local chef to lead a cooking demonstration featuring healthy versions of traditional dishes. Ask a respected elder to share their insights on the importance of rest and traditional sleep practices. When people see familiar faces and hear voices they resonate with, they're more likely to feel seen, heard, and invested in the program's success. Chapter 4. Education Tools. Making learning engaging and effective. Let's talk about making our workshops both informative and engaging. We're competing with a lot of noise out there, so we need to capture people's attention and make sure the information sticks. Ditch the lectures and embrace interactive content. Think visuals. A powerful graphic illustrating the impact of sleep deprivation on memory, mood, and even physical health can be far more impactful than simply talking about it. Use food demonstrations to bring healthy cooking to life. Imagine the aroma of spices filling the room as participants learn to prepare a delicious and nutritious meal together. Incorporate quizzes and games. What's your sleep score? Or a healthy habits bingo can make learning fun and encourage friendly competition. Hands-on activities are also fantastic. A workshop on mindful eating could include a guided meditation or a session on identifying hunger cues. A sleep workshop could involve participants creating their own personalized sleep hygiene plans. Remember, the more engaging and interactive we make the learning experience, the more likely it is to resonate with participants and translate into real-world change. Chapter 5, Practical Solutions. Empowering sustainable change. Finally, let's talk about the outcome we're all striving for. Empowering participants to make lasting changes. Our workshops shouldn't just be about information overload. They need to equip people with practical tools and strategies they can implement in their daily lives. When it comes to healthy eating, focus on simple, budget-friendly recipes. Think 3 to 5 ingredient meals that can be easily replicated at home. Offer meal prepping tips and tricks to make healthy eating more convenient. For sleep, let's get practical. Discuss the importance of creating a relaxing bedtime routine. Introduce them to free or low-cost relaxation techniques like deep breathing exercises or guided meditation apps like Calm. Address common sleep disruptors and brainstorm solutions together. Could they try a white noise machine to block out noise? Would blackout curtains help create a darker sleep environment? Remember, the key is to make these solutions feel achievable and sustainable within the context of their lives. Small changes consistently applied can lead to significant long-term improvements. By focusing on these 5 areas: cultural relevance, access barriers, community engagement, education tools, and practical solutions, you can create workshops that truly make a difference. So, what do you think? Are you ready to build programs that help communities eat better, sleep better, and live healthier lives? Let me know in the comments what ideas you're excited to implement or any challenges you're facing in your programs. Don't forget to like, share, and subscribe for more strategies to improve community health. Let's keep building healthier futures, one workshop at a time. See you in the next video. You are making meaningful change.